Cone Health is committed to healthcare and well-being. This is our investment into doing that.
In fact, Cone Health's new $97 million MedCenter Greensboro at Drawbridge Parkway off North Battleground Avenue and the northwestern edge of the new urban loop represents a continuing evolution of that healthcare component, as Cone Health's Vice President Ambulatory Network, Dino Adkins, oversees all 5 of the MedCenters Cone Health has built throughout the community. What is the main difference between a MedCenter and a hospital?
A MedCenter is all outpatient services. And so a hospital will have some outpatient services and primarily acute care inpatient services.
So in other words, patients do not spend the night here at a MedCenter?
They do not, unless they're in an emergency department for an observation.
Okay.
For a period of time, which is usually 23 hours or less.
In fact, through this entrance is the Drawbridge MedCenter's 24/7 freestanding emergency department. Patients can walk right in or be brought in after riding in an ambulance that can park in one of 3 bays out back. You're equipped to handle 100 patients a day here?
Yes.
Okay.
Yes.
Very good.
And we believe that's going to ramp up over time.
This ER, with its 18 exam rooms, is equipped to handle just about any medical emergency. Patients who end up needing overnight care, like those with severe injuries, are seriously ill, or are suffering heart attacks or strokes, can be stabilized here before Cone transfers them to its traditional hospitals. 2 physicians or providers will be on duty here at all times, as well as 4 to 5 nurses. But the MedCenter doesn't stop at emergency care. In addition to outpatient cancer services like chemotherapy, which will happen in this room, the MedCenter has offices for doctors specializing in primary care, orthopedics, OBGYN, and cardiology, among others. There are imaging services on site, as well as a laboratory. There's even a full retail pharmacy with a drive-through window, which is on the bottom level of the 526-space parking deck, designed so you can park on the same floor as the service you'll receive.
So physician and the care team write the prescription, you would leave, same level parking as your appointment, drive down the parking deck and actually pick up your prescription before you leave campus.
But you can't leave without noticing the well-being part of this place. This is Sagewell Fitness. The name combines the word sage, as in a wise person, and well from the word well-being to describe a different type of exercise facility. What's the difference between Sagewell and the regular gym or fitness center?
So our intent is that we would integrate with our medical community how best to take care of patients. And so imagine a provider writing an exercise prescription for their patients. We would monitor that and partner with them on a daily basis.
At first, each person who joins Sagewell gets a free fitness assessment and an exercise prescription or plan that meets his or her needs. A staff member is always on duty to help meet goals and introduce the equipment. Personal training's available. So are group fitness classes that include spin bikes. There's also a whirlpool and 2 swimming pools, including one where you can swim laps under the watchful eyes of a lifeguard. In this large room, other recreational activities happen, including pickleball, volleyball, and basketball.
You got it. Yes.
In the play area, babysitting and other learning activities are available for children at what Cone Health calls nominal fees. And this will be the eating area for an on-site restaurant open to the general public that'll serve nutritious meals.
This is the future of healthcare and well-being, connecting those services. So, Neil, I'll tell you, we've seen health systems who've done a great job across the country build medical fitness facilities. This is Cone's not only attempt, but commitment at literally connecting those services.